Let's react to this video called The Dangers of Hair Transplants by a French YouTuber, Dr. Nazman. And this is auto-dubbed, so should be interesting.
Getting hair implants. But how does it actually work? What do they do? Does it hurt? And most importantly, why do we lose our hair? As time goes by, life removes hair where it should be and adds it where it shouldn't. I find it absolutely disgusting. Okay, we agree that baldness can be worrying. I myself can see the density of my scalp changing. There's a very thin layer of hair gradually setting in. Okay, so that's it. Then again, I also think it's just a vitamin D deficiency. That's it, nothing more. Transplant or transplant, that's the question.
He's throwing out a lot of information here. Let's see where he goes with this.
I don't necessarily feel ready to get implants yet. I don't know why. I imagine that maybe it's a matter of feeling.
I think it's important to start with like your goals, right? Because no one actually wants to have surgery. Let's be honest here. I mean, it's going to be expensive. It's going to be slightly uncomfortable. You know, there's a recovery phase to all this. So no one wants to actually get the surgery. So like people do it for a reason. They want to have better hair. But a lot of hair restoration doesn't necessarily include surgery. It includes proper medical therapy. It includes proper care of your hair. So I think it's important to keep that in mind. It's like, what is your goal, right? Every person may have a slightly different goal, and it's important to try to address that, at least when people come to me seeking my clinical medical guidance. That's how I think about it, rather than just like, oh, surgery. You know, it's sometimes surgery is the answer, and usually it's not just the answer. Usually it's that with medical therapy. So it's important to take a step back and think about goals.
This video should become a sort of discussion forum on best practices. I'm sure the little tips will help a lot of people. Demystify things. Does it hurt? Does it not hurt? How much does it cost? Or go ahead and have fun. By the way, a quick rant. Sometimes, I'm on TikTok like this and I see surgeons from transplant clinics reacting to people on the internet to say whether or not they need a hair transplant. Except that the people concerned didn't ask for anything.
Yes, that is an important distinction. If someone never asked for advice and if they never talked about their hair and you're going in and basically suggesting that, hey, they should have a hair transplant, I think that's wrong. What I do on my channel here is a lot of times I'm speculating on procedures that I think they may have had, and I'm usually providing kind of evidence for that in the way that, you know, we create our videos and analyze all the photos and videos that we can. So that is different from saying that someone should get something done. And sometimes a celebrity might mention wanting to get something done, and then we might jump in and basically give free advice to that person. But I agree with Dr. Nazman that we shouldn't just go around and basically tell people, oh, they need surgery, because a lot of people are comfortable with how they look and they're not necessarily looking for a doctor's opinion that might be telling them that they should get something that they don't want. So I think he brings up a good point, and it's an important distinction.
Anyway, let's get to hair transplants.
Le greffe de cheveux. Sounds like hair graft.
First of all, a little statistic to get straight to the point. According to the Hub, the number of bald French people, men and women combined, has not changed much over the years. It doesn't seem to change much. The last available data was in 2015, with 13% of French people reporting having baldness, and if we go back to 1990, it was 12%. So, you see, it's not really changing much. On the other hand, these stories about baldness, perhaps over time, we're taking it worse. Let me explain.
Well, there's a difference between baldness and hair thinning. Hair thinning is extremely prevalent in the global population, I think at higher numbers than what he's saying here, but very significant hair loss where things are so depleted that you can call someone more bald, then maybe those numbers are more accurate. But I think there's a continuum there. Some people just have a little bit of thinning, some people have more advanced thinning, but it's a much higher percentage of people, men and women, that have thinner hair as they age. It's part of the aging process. So it's actually at a much higher incidence globally than I think the number that he's listing here.
Particularly because of the cosmetics industry, which has made it a bit of a health problem, but also because of certain advertisements that have helped change the perception of baldness. They were really bad ads when you look at them today. It's really crazy how much it's free. It's almost a bit funny, but it's really a gift. So before understanding why we lose it, it might be interesting to know how it grows. That will help us understand a little bit more about what happens next, as you'll see. Well, hair grows in phases. First, there's the first phase, which is called the anagen phase, where the hair is born in a hair follicle. It will grow slowly and develop. It will be made of keratin and melanin, 10% water, lipids, and trace elements. It's a nice little cocktail.
And about 90% of our hair on the scalp is in the anagen phase. But the percentage of hair in anagen phase actually goes down as you go to other parts of the body. So facial hair doesn't exist in anagen at the same rate. And as you get even lower into like chest and back and legs and arms, it's an even lower percentage of hair that's in that growth phase. And that has some ramifications for transplant surgery. When people ask me, oh, why don't you take hair from the toe or from the leg and put it on my head? That's part of the reason why long term we don't see great results with the use of this body hair from areas other than the head and neck.
Then comes the catagen phase, where the hair stops growing, the deeper part of the hair will disintegrate, and this phase lasts between 2 and 3 weeks. Finally, there's the telogen phase. And this is the final phase. This is a phase that lasts several months, during which the hair dies. It is pushed outward from the scalp by another hair that says, hello, hello, I'm coming, you, get out of here.
This is more of the shedding phase here.
New hair is in its anagen phase, the very first one, and so on. The sequence of these 3 phases forms a cycle called the hair cycle.
Throughout our scalp, the hair is in different phases of the hair cycle. So again, when we do hair transplant surgery, that's why as the hair starts to grow in at like month 3, 4, it's not completely synchronized because it was never synchronized to begin with. So some parts might grow in a little faster than other parts, and that's actually the reason why.
It's a cycle that causes the loss of 50 to 100 hairs per day. This is completely normal. In any case, we have between 100,000 and 170,000. So you really have a small stock.
And there's actually less hair on the head of people with thicker caliber hair or very curly hair. You physically cannot fit as many hairs when the hair is super thick and super curly. So the overall number of hairs is actually lower in those populations.
And this entire cycle will repeat itself 25 to 30 times before the hair follicle can no longer produce hair. That's the fatal moment. Nothing more comes out, except that 25 to 30 hair cycles. If you're lucky, you're good to go. Yeah, easy. It can last a lifetime actually, except that if you're a little less lucky and you're affected by endogenous alopecia, the scientific name for baldness.
Androgenetic alopecia is a technical term, but again, with this auto-dubbing, I guess something got lost in translation.
There you have it. In people affected by baldness, these cycles last less time, so they happen more quickly. Which means that you end up with hair follicles that can no longer produce new hair. You see, nothing comes out anymore, no land, that's it.
And for the androgenetic type, especially in men, we know the importance of DHT in leading to that miniaturization. But remember, it's not just like the level of DHT in your bloodstream, it's also how sensitive your hair follicles are to the DHT that is swimming around. If you have a higher sensitivity of your DHT receptor in the hair follicles in the DHT sensitive zone, you're going to be more likely to go through those miniaturization cycles quicker than someone with less sensitivity of their receptor. And that's important because some people ask, well, why don't you just get blood work on everyone? Why don't you check my, testosterone, my DHT? It's because it clinically doesn't necessarily change anything, because you can have very low levels of circulating DHT and yet be experiencing very advanced hair loss because of the sensitivity of your receptors. That's an important concept.
Hair loss can also be due to other factors, you see, like stress, illness, weight loss, etc.
Yeah, vitamin deficiency, other medical conditions, certain medications that people are on. There's lots of things that can lead to hair loss. Of course, radiation therapy, the list goes on. But he's right, the most common form of hair loss in men and women is androgenetic alopecia.
But the main cause is still endogenous alopecia. So, there's obviously a genetic link, it's in the name, actually. But depending on the person, this genetic link can be more or less strong. Personally, that's my father's skull when he was 25. I'm 35. I consider myself lucky already. There you go, little stray bullet.
Yeah, the genetics are very complicated. We know that the genes for hair loss are on at least 60 alleles in our genome. So it's really not just one family member that you can look at and say, I'm definitely going to have their pattern. So it's good to look at family patterns in general. And if you have hair loss that's significant on both sides of the family, chances are you're going to go down that road to a degree. But exactly what your pattern will be when you're older, it's always hard to tell at a younger age.
Then, there's also testosterone, which apparently plays a major role in hair loss. That's why baldness is more common in men. To understand this link with testosterone, some researchers conducted experiments that weren't exactly crazy. There you go, you'll understand. Let me put it in context. So, it's 1942 at the Winfield State Training School in Kansas, in the United States. And in this institute, they have the bad habit of castrating their residents. Their residence is for people suffering from mental disorders, and their practice of castrating everyone is heavily influenced by the eugenics movement. There was a researcher there, James Hamilton. He didn't hesitate to test everything, and in 1942, he published a study that showed that men who were castrated before puberty did not suffer from baldness. And that was true even if there was some in their family. But to go all the way with his idea,
That's one way to prevent hair loss, but I think most people would not want to sign up for that one.
he also injected testosterone into 12 residents. 4 of them developed alopecia and then stopped doing it once the treatment was over. Then they started doing it again once the treatment was resumed. There are even photos to prove it. He therefore concluded that baldness was linked to testosterone.
And it's specifically linked to the more potent version of testosterone called DHT, or dihydrotestosterone. And one thing that can confuse people sometimes is when they get on finasteride, the testosterone levels actually go up. The DHT level comes down, but finasteride is blocking that 5-alpha reductase conversion of T to DHT. So as you block that conversion, you're going to actually drive testosterone levels up. And that's kind of a misconception out there. It's very important to realize that it's actually the DHT that is the primary driver of hair loss.
So this story about testosterone, we often hear that it is linked to having too much of it, but in fact it is more linked to hypersensitivity to testosterone, and more precisely to dihydrotestosterone. Now dihydrotestosterone
Precisely.
is a hormone, but each day the body converts about 10% of its testosterone into this more powerful form. This more powerful form, dihydrotestosterone, will bind to the androgen receptor in the hair follicles, which will cause them to shrink. They will be thinner, more fragile, and therefore fall out more quickly. This will shorten the hair growth cycle that we were talking about earlier, and so bam, more quickly you will have more hair, not a single hair on the rock. No, well, it is progressive. You get the idea, but there you have it. So there you have it. You already have an idea of how it all works. Except that if I take the photo of my father, a little snob, you'll see that he still has the famous crown that remains behind, huh? The hair at the back doesn't move. Well, that's because dihydrotestosterone has no effect on the hair at the back and sides of the head.
Yeah, we talk about that zone as being DHT resistant. For some reason, the way we're constructed is that back portion, that horseshoe, is DHT resistant, whereas the central corridor is DHT sensitive. That being said, some people will experience significant thinning of that donor area to the point where the horseshoe can become very, very small. And when they're younger, it's harder to predict exactly where they're going to land as far as the height and the extent of that horseshoe. And when it's the donor area for, let's say, FUE surgery, that becomes tricky because we're harvesting broadly. And if we harvest broadly and the person's not on proper medical therapy as they get older, now we'll create a scenario where a lot of the transplanted hair may not survive because it was DHT sensitive from the get-go.
And yeah, those, my friend, they're spared. Don't touch them. It would have been nice if it had touched that part but not the top, you know. I think there would have been a way to do something nice with a gradient. Here in the other configuration, it's a little more complicated. Sometimes it doesn't hang on, you know, but hey, no luck. It's the top that takes over, and that's life. That's how it is. By the way, I imagine you've already seen this kind of drawing that allows you to see your progress. By the way, where am I at?
So keep in mind at the bottom there you see the more of the Ludwig scale for women with androgenetic alopecia. It's a different pattern. The hairline is usually fairly preserved and they have a central widening that occurs. Whereas for men, of course, we know that the hairline can recede, the crown can start to expand, and there are many, many different variants of this, right? It's not just like these types and that's it. There's probably hundreds of different varieties of androgenetic alopecia that I see in the practice. And then, of course, you have other types of hair loss. Alopecia areata, which is what I have in a more severe form, as you guys know. There's also scarring alopecias. There are different types of like telogen effluviums where temporary shock loss due to various forms of stress or even viruses can create that, where most of the hair will return with time. But lots of different forms of hair loss, but here they're displaying some of the variants of androgenetic alopecia.
I have to wander somewhere in between, okay? I'm making my way through here. Oh, man, but the drawings at the top, they're really bad. There are really two hairs, you know, that's all. Well, you can also see that these drawings also show women. Because yes, women can also be affected by baldness.
And we have a video about women's hair loss specifically, so make sure to check that one out if you're interested. And that's also why the hair care products that we created are not just for men, they're for women too, because we put in natural DHT blockers in there, we put anti-inflammatory compounds, we put in compounds that help stimulate blood flow, and the redesigned packaging of our products is going to launch hopefully in the fall of 2025. So here it is, right here, the new packaging, which will be exciting now with the pump and with the nice soft touch and updated graphics. So I think everyone will enjoy those. So make sure to check those out.
So, 25% of men are affected by baldness during their lifetime. However, in women, 2% of all ages combined and 1% experience hair loss during their lifetime. Not necessarily permanent, by the way. That's the nice little bonus. In our case, the hair falls out. Thank you. Goodbye. Have a good weekend. It was nice spending a little time with you. Now it's time to go, to leave. Whereas in women, it can be temporary. It can come back.
I think he's referencing telogen effluvium, but in all honesty, women oftentimes experience progressive thinning that doesn't necessarily come back. So yes, men and women can experience temporary shedding called telogen effluvium, where the hair, for the most part, returns. But most women who experience androgenetic alopecia experience it in this progressive, gradual loss of hair that isn't necessarily returning, even with the use of various forms of medical therapy.
So we're talking about female endogenous alopecia, and it doesn't necessarily manifest itself the same way it does in us. In men, it is often the hairline and the top of the head. Whereas in women, it is more of a progressive thinning at the hairline and then the top of the head. It can start at the age of 40 compared to the age of 30, or even earlier in men. Incidentally,
again, there are plenty of women in their 20s and 30s that are experiencing significant androgenetic alopecia. And let's give them a voice, because they are also sometimes going through really, really hard times. In many ways, maybe even harder times than men, as they continue to lose hair. And that's something that I think has been underappreciated and underreported over, the last bunch of decades. And I think that's starting to change.
The mechanisms of hair loss in women may not be exactly the same. Specialists also believe that it is probably linked to an increase in endogenous activity, so basically testosterone. But there is still a lot of confusion because the vast majority of studies are conducted on men. So, how does a hair transplant work?
Le graphe. Love it. It always sounds better in French, you have to admit.
So the good news is that if you suffer from baldness and want to do something about it, there are solutions, such as a transplant.
Well, there's different solutions out there. Some people are more than happy being bald. That's a solution. There's scalp micropigmentation, the deposits of ink that can help at least give a two-dimensional illusion of hair, and works for some people. There are hair pieces or wigs that people can get, and those systems, need regular maintenance, but some people prefer that over surgery. Remember, for surgery, you need to have adequate donor supply. You need to have stable hair, and you need to have realistic expectations on what's possible. And some people aren't good candidates for one of those reasons, or sometimes a combination of reasons. Each case is very different. Each design of a transplant is very different. I always try to get this message across in the best way possible, that hair transplants is an art form. It's not just about planting and having grafts survive. It's about recreating natural configurations artistically so that the person looks as natural as possible. And so that is really what it's about. It's not just about moving some hair around.
The idea is to take hair follicles from the back of your skull. You know, the immortal hairs that don't move. Well, those are the ones that will ultimately be useful. Oh, that's pretty good news. So they'll look there, and the next step is to make small incisions of less than 1 millimeter in your skull. Pack in the bald areas.
So he's describing FUE surgery, but remember, FUT surgery was the way that hair transplants were performed for decades, before about 2015 when FUE became more popular. FUT is still a very viable procedure that works. It's just kind of a dying art because a lot of people have switched over. But especially for female cases, it can have its utility. So I think it's an important technique for hair surgeons to know how to do.
It's about the size of an egg, and the final touch is to reimplant these hair follicles that are immune to baldness in the bald areas.
Remember, if you're harvesting broadly, which we usually are with FUE surgery, especially when the person is younger, you don't know exactly how small that horseshoe will get if they're off of medical therapy. Some of what's taken might still be susceptible to loss, especially off of medical therapy. And when I say medical therapy, I'm specifically talking about finasteride or dutasteride. Those medications are what actually prevent further hair loss. We have finasteride available at feelconfident.com along with oral minoxidil. For dutasteride, people need to actually call our practice and talk to us before we prescribe it because it is a bit stronger than finasteride and it does carry slightly more side effect risk. So I'm a bit more careful about when and how we prescribe that one. But for the right person, it can be very effective if they're breaking through the control of finasteride for further hair loss prevention.
Take, open, reimplant. That's the idea. So this technique, or at least the first technique that exists because there are basically two, is the strip technique or FUT for follicular unit transplantation. Why strip, you might ask? Because the surgeon will take a strip of scalp hair, about 1 centimeter high by 10 to 20 centimeters.
Depends how much hair you need. Usually the height of my strips are about 1.2 to 1.4 centimeters, and the length will just depend on how much hair we're looking to get. If it's a small eyebrow procedure, we might be looking at a length of about 6 centimeters. If it's a larger, let's say, hairline procedure where I need over 2,000 grafts, then the length might be closer to 16 to maybe 22 centimeters. Just depends on what you need.
There, he will divide this strip to form small piles of invincible hair. There, he will preserve them in serum while they are implanted. A little bath before. There you have it, the new life.
We personally use Plasmolite and ATP as an energy source for the survival of our grafts when they're outside of the body, when they're in solution. And that's also what we put into a spray that we give patients for use on the day after their hair transplant so that we can keep everything as moist as possible and for them to properly care for the grafts post-op.
In short, this removal can leave a scar on the back of the skull. Well, generally, it is hidden by the hair that grows.
Well, the FUT scarring is always going to be there. There's always going to be a scar. It's just a question of, how does the scar exactly look? For some people, it can be just a fine white line, and for other people, it could be quite thick and cross-hatching. And of course, a lot of that is surgeon dependent on how the scar looks. But there are, of course, some patient variables that might change the quality of the scar.
But that's also why you can't do grafts indefinitely. And the second technique, also the most recent, is the FUE for follicular unit extraction. So here, you shave your head or at least the donor area to isolate the follicles.
You don't need to shave your head in all cases. We do offer no-shave FUE for both recipient and donor areas for the proper candidates. So when we're not shaving the back, we have to drop the case size because we can't harvest as many grafts as we can when we do shave. The recipient area, there's almost always a way to keep that unshaven. It depends on the scenario. If someone's had prior surgery or if they have very curly hair, I might still strongly recommend to shave the recipient area for proper visibility and accuracy. But oftentimes when patients ask for it, we can usually do some form of a no-shave for them. So it's not true that you always have to shave your head for a hair transplant with FUE.
Then, using a punch, a sort of hollow needle, the grafts are extracted one by one. It takes a long time. The grafts are sorted and preserved in saline solution before being reimplanted.
Yeah, hair surgery takes a long time. He's right about that. This is a very meticulous process. This is a repetitive process. It takes an entire team. It's never one person doing the whole thing. Of course, you want your surgeon actively involved with the surgery, but you have to realize that surgeon is going to have a clinical team that they hopefully trust and that is very good at aiding them in properly executing your procedure. But yeah, expect to be in the clinic for many hours, usually anywhere between 6 and 12 hours to do a larger hair transplant. That's how long the stuff takes.
This procedure is performed under local anesthesia, so it should not be painful.
We also supplement the local anesthesia oftentimes with some PO sedation, meaning Valium, Ambien can be used to just take the edge off so people are a little less nervous, especially in the morning. There are some places that will offer IV sedation so that you're not even conscious during the procedure, but I think for as long as the surgery is, it is safer, in my opinion, for the person to stay awake instead of being put to sleep. But that's my personal opinion. We almost never do hair transplants under IV sedation. In contrast, when I do surgical hairline advancement surgery, which we have a video on, that surgery I do perform with IV sedation because it's a bit more invasive as far as how the procedure is performed compared to a hair transplant.
It lasts between 4 and 6 hours for FUT and between 6 and 8 hours for FE.
Could be even longer. Again, it's properly executing the surgery as long as it takes. Well, you don't want the grafts to be out of the body for too long, but you want to take the time to do proper work. This is not a race. These are results that will last with people for their entire life, hopefully. We take that very seriously in my clinic, and we take our time to do the work properly. And I think that's an important consideration when people are looking for, a surgeon, that is their mantra and not, we're going to rush and get it done in 4 hours. That's not how this should go.
So you have to plan your day, and at the same time, it is a lot of work. It is not just anything. There are still thousands of hairs to be carefully reimplanted. Okay, let me know in the comments. You come out of there with a nice bandage around your head to protect the donor area.
We believe in sending patients out of the clinic without a bandage so that they don't have to worry about removing something and potentially disrupting some blood clot and having bleeding when they're not in the clinic with us. So we make sure that everything is nice and dry before they leave and there is no bandage applied. For some patients, they request some head covering so we can put a surgical cap on their heads as they're leaving, and that can help conceal some of the work, but we prefer no bandage. And we have a video on our post-operative care if you want to check that out.
After that, it takes about 4 months for regrowth to begin. After your grafts, your implanted hairs have fallen out. So, if you see your grafts falling out, don't start harassing your clinic. It's normal. It's part of the process.
If grafts fall out too soon, like in the first 72 hours, you would get bright red blood coming down from where that graft was placed, and that indicates loss of graft. And that almost never happens on its own. I've never seen that happen on its own. It's with trauma. So if the person accidentally rubs the area or they bump their head on something, or as I've had one patient do in the past, he tried to put a t-shirt on over his head after some crown work the day after surgery, even though we've told him many times not to do that, but some people will try. And then he had loss of grafts and bright red blood coming down and definitely lost some of the grafts that were placed. So that is when you know that you've lost some grafts. Usually it's not a huge number of them, but it's possible to lose some grafts in that way. After about 72 hours, when the grafts are secure, like internally the blood supply has linked up, it's very difficult to really kind of mess things up. After that, there's still instructions that will usually go till at least 2-3 weeks out. But it's important to realize that if after that point, usually at as early as maybe 7 days, 10 days, when the crusts are starting to come off, if you see some shafts come out, that is actually quite normal. It's not the actual follicle, which is like the engine that creates the shaft. It's typically the shaft, maybe some dead skin, maybe some crusting. That's the kind of stuff that you see at that point.
They fall out and then they'll grow back and redensify the area. Not perfect. It's still a clever technique, right? And normally, if the graft is done well, if it holds well, if it takes well to you, your new implanted hairs will stay there forever. The procedure is simply a redistribution of your hair capital. You're there, you're reorganizing things a bit to your liking.
Correct. And then the medical therapy helps prevent further loss of hair. So those two go hand in hand.
So, can this procedure be dangerous?
It's real surgery, so of course it has its risks and potential complications. We have a video on that, so make sure to check that out if you're interested in learning more about the risks.
Ultimately, in most cases, when practitioners know what they're doing, there's no danger. The worst thing would be possible infections or necrosis, although that's very rare. Then, there can be aesthetic problems, like samples that are too dense, for example, not sparse enough on the backside, so they're too visible, a devastated donor area, unnatural lines, or even hair that grows in the wrong direction. That would be a shame, though.
But there have been deaths with hair transplant surgery, so I'm not sure if he's going to get into this, but the most common reason for an actual death from this procedure is intraoperative from lidocaine toxicity. Remember, in order to numb up all those areas, there's lidocaine or Marcaine that's used, which is an anesthetic that can have cardiac and neurological toxicity if too much of it is used. So again, it's really important to go to a good, safe clinic with a surgeon that knows what he or she is doing and has a team that works well together and that can deliver, at a minimum, very safe care. And then, of course, you hope for a nice aesthetic result as well.
So if you're planning to do it, the best thing to do is to choose your clinic carefully, discuss it thoroughly with them, and so on. This step, the choice, the discussion, taking your time.
And when it comes to the aesthetics, make sure to check out the gallery. You want the gallery to speak to you in some way. You want to see the aesthetic that surgeon specifically, not just the clinic, but that surgeon creates on average, right? You see the kind of the balance of their work, and you see if that resonates with you. If it doesn't speak to you, if it doesn't resonate with you, well, don't go there. Same thing if you just see someone has a big social media following, but you can't really find their gallery, or the gallery's not very impressive, or even if someone's been in practice for 30 years, but you look at their stuff and it's just like not very natural, not very dense, it doesn't look great. Don't go to them just because they've been in practice for 30 years. Choose wisely. Check the reviews, check all this stuff out. The testimonials, what are they posting about? I mean, all these things matter when you're picking a hair surgeon.
I think is super important. It could possibly help you avoid ending up with something really badly done because it's affecting the physical aspect after all. And by the way, not long ago, there was a story about a patient who committed suicide after a botched beard transplant in Turkey.
We actually filmed a short about this unfortunate gentleman, so check that video out if you're interested in it. This was definitely a very sad case indeed.
The hair was growing straight. He was in a lot of pain, and he developed mental health problems. In short, it can go very far, so be careful when selecting a beard transplant. It seems very important. Then, you also need to know if the transplant is right for you, because practitioners don't necessarily recommend it for everyone. Their goal is to do a good job, something well done. It's not just about taking your money, normally, they try to do something good. For example, they recommend it for people who are losing their hair due to endogenous alopecia areata or alopecia areata, which are other types of diseases that cause hair loss.
I think something was lost in translation here. He probably had said androgenetic alopecia, or maybe also alopecia areata, but alopecia areata, which is my condition, I have like an extreme form of it, but for more mild cases, there are certain criteria that we look for in order to pick someone as a candidate. But there are other conditions, like I mentioned, scarring alopecias, like in planopilaris, for example, frontal fibrosing alopecia. There are trickier cases where in order to operate, you want stability of the area for a number of years, and you really ought to often get a biopsy of the area to confirm that there's no active inflammation before you go in and do a transplant. And even then, if the person is already prone to an autoimmune or to inflammatory conditions, of course that condition can always resurface later on, and you might not get as great of a result long term. But for some patients, if they can get a number of years out of it, it might still be worth it. But it's important to disclose that and to discuss that openly with patients.
It is also advisable to have stabilized hair loss because, of course, otherwise the loss will continue even after the transplant. You see, your grafts will not fall out. No, but behind the implants, it will continue to grow, you see. So, if you undertake to do this, observe your body, take your time, ask yourself the right questions. How is the area changing?
Yeah, definitely don't rush into this process. You definitely want stability, and a hair transplant is never some emergent or urgent process. It should never be that. It should be done at the right time when things are nice and stable, and you're on proper medical therapy, and you found a surgeon that you really trust who's generated great results for many, many other people in the past, and only then do you proceed with this process.
You see, it seems important to take this into account to avoid ending up with a donor area that has more stock. First, since there is no limit to the supply, you see.
That's a good point. The donor area has limitations. It's not an infinite supply. So we have to be good stewards of that donor supply and use it carefully. And that's also why I don't believe in these like massive giga sessions where all the hair is depleted in a single session. I think it's better to space it out, do discrete procedures that deliver impact, but that don't completely deplete the donor area.
It is not an open bar. You have to be careful. You see, you must not implant everything at once, otherwise you risk ending up, as I said, with an empty donor area. In this video, as you understand, I am focusing solely on hair loss and transplantation. So we are not going to talk about minoxidil, PRP injections or microneedling. No, it would take too long otherwise. So what is being studied at the moment? Are there other ways to make our hair grow back?
He didn't really mention finasteride. That's actually the most critical one for guys, but I guess he's going to go into something else now. Let's see what he says.
There are other things being studied. Well, still under study, mind you, but there are other things. In particular, with the identification of the signaling molecule SCUP3. It is responsible for activating hair growth. So potentially, maybe one day we could use this protein naturally produced by the body to promote hair growth.
Right, but you see, the SCUP3 is going to be in the general category of stimulants or things that create a little bit more fullness in the existing hair. It's not going to be a preventative type of agent. And from the SCUP3 team themselves, they've said that they're not anticipating that areas that are more bare, that have significantly miniaturized, are not all of a sudden going to sprout a lot of hair. So essentially, from my understanding, SCUP3 is going to be similar to minoxidil, maybe with fewer side effects, but unlikely to truly revolutionize our options for hair restoration, I don't think.
We will see or micro-inject this protein into the scalp to induce hair regrowth. Researchers have conducted tests on mice and the results are apparently promising, so we will have to wait and see.
Cloning has also been done on mice, but we're not that close to human trials and actual working hair cloning in humans. Also, there's a lot of stuff that works in mice that we don't necessarily always translate over, and when we start to translate it over to humans, we realize it's actually fraught with a lot more challenges and obstacles than we originally thought.
And let's not forget, in any case, to accept and respect each other. Whether we have a lot of hair or not, it doesn't change anything. We respect each other. We're all human, don't worry. In any case, thank you all for watching this video.
Yeah, I mean, there's definitely like an emotional component here. For most of my patients with hair loss, it's a big deal for them, and it interferes with them being able to truly enjoy their personal life, their work life, because they're constantly thinking about the hair loss. And so if we can reverse that, if we can help them with that aspect, usually they're able to just move on, not think of it as much, and they generally enjoy life a little bit more and they feel a bit more confident. And that's truly the goal here. So I thank Dr. Nazman for his really nice delivery of the basics of hair and how it works with the hair cycle and how transplants work and raising some of the risks and dangers that do exist. I think it was a great overview. So I enjoyed it. Hope you did as well. Thanks.